Hi everybody, this is Dale Stringer with First Medicare Advisors. Welcome to my office. Now in this particular video we're going to be exploring what changes we should expect for Medicare in the future. Now for total transparency, I do not have a crystal ball to consider the future. If I did, I probably still wouldn't be working. But here it is, in my humble opinion, the future of Medicare. Now, as an independent broker, it's my job to help folks just like you with your Medicare supplement plan. That includes all of you who are getting ready to turn age 65, those of you who have already turned 65, and you probably already have a supplement plan and you may be looking for the lowest rate for the exact same plan that you currently have. Okay, now, what changes should we expect from Medicare in the future? We're already seeing a lot of changes. The annual deductible for Medicare's Part B to cover doctor bills increased this year to $183 from $166 in 2016. You can also expect to see higher premiums and deductibles rise for your Medicare Part D plan to cover your prescription drugs. I believe the biggest change will be to try to gain control over Medicare's rising growth. This comes from the large number of baby boomers coming on to Medicare and their age-related expenses for illness. You'll probably see a moving away from the current fee-for-service plan like you have right now with Medicare Parts A and B. Most likely what's going to happen is you're going to move into a private insurance plan like the current Plan C, the Medicare Advantage plans. Most likely you will move into the private health insurance plans like the current Plan C, the Medicare Advantage plan. Under this option, called what is known as the premium support, you would choose a private health plan and the federal government would make a predetermined contribution for medical expenses. Any unreimbursed balance due will then be paid by you. Now, the Medicare Advantage plans has many variables and unknowns from one year to the next. It's tough enough to make it on a fixed income now. Add in the unknown of medical expenses is grounds for your own personal financial disaster. And let's face it, who needs that? Now, if you have a question or need help with your different parts of Medicare, feel free to give us a call at either our recorded hotline at 1-800-958-8171 and record your question or request. The second and quickest way is to just call my office direct at 1-800-825-2919. You'll get an answer that hopefully will point you in the right direction. Now, another area of concern is what will your monthly premium be for your Medicare's Part B that covers 80% of your doctor visits and outpatient procedures. Now, if your monthly premium for Part B is based on your income, and the 2017 base monthly premium is $134, but honestly, not everyone is paying this amount. If you have your Part B monthly premium deducted from your monthly Social Security retirement check, you will pay less than the base monthly premium of $134. Now, about 70% of Social Security recipients will have a lower monthly premium under the provision that's called the hold harmless. Now, your Part B premium is protected by this hold harmless provision will be $109 each month. Now, on the other hand, if you're single and your income is below $85,000, the base premium is $134. Now, if your income is between $85,000 and $107,000, your premium will rise to $187.50 per month. Above $214,000, your monthly premium will be $428.60. Now, if you're a couple, just double those income figures and find out what your premium would be. However, you might not be protected by this hold harmless provision. I'm seeing this happen with new enrollees to Medicare. Now, if you're new to Medicare and enrolled in like 2016 or 2017 or sometime in the future, you're already paying the higher income related premiums that were just mentioned. Now, something else to look out for is if your income changes from one year to another. Your Medicare Part B and your Part D premium for your prescription drug coverage are both based on your annual income from 2 years ago. So your 2018 premium for Medicare Part B and Part D will be based on your annual income in 2016. Now, for total transparency, I do not have a crystal ball to consider the future. But based on experience, you can believe that Medicare will change both in premiums, deductibles, copays, and coinsurance. Now, if you have a question or need some help with the different parts of Medicare, do feel free to give us a call at either our recorded hotline. That number is 1-800-958-8171. My office at 1-800-825-2919. You'll get an unbiased answer that'll point you in the right direction.